hard or a soft brush?
Only soft and always soft, always, never hard. Or even medium is too abrasive.
Oh, really?
Yeah.
Okay.
Yeah. Okay, so I think a lot of people know what I'm going to say. Everyone focuses on brushing their teeth, but a lot of us miss flossing. So that's the number one thing I see is patients are not flossing enough. So not a lot of people know what a biological cleaning is.
Oh.
It's like a little powder and it's like a blueberry. It smells really good.
So what do? Do you just keep it inside your mouth?
Yeah, it's just a powder. You just like sprinkle it in, let it sit there, then it does its magic, and then that's it. And all the patients love the taste. Like they ask me about it. Yeah, it's really good taste. Yeah.
Amazing. So I definitely need to... Welcome back to Dr. Rose BioHealth Podcast. Today we are joined by Rebecca, our hygienist in our DIFC clinic. She was born and raised in Alberta, Canada, and is Lebanese Canadian. You completed your diploma in dental hygiene at the University of Alberta. You went on to completing your dental hygiene degree, specialising in clinical teaching, and was a board member of the academic committee of the Faculty of Medicine and Dentistry. Try and say that 3 times. Yeah. During her studies, she was the president of the SMILE program of University of Alberta and a volunteered organisation that provides oral health education in primary schools. Ooh. One of Rebecca's passions is pursuing and teaching patients about improving and maintaining their oral health on a daily basis. And you strongly advocate teaching your patients about their overall health, really. Mm-hmm. So welcome to your first podcast. Sorry, a little bit delayed, but welcome.
Thank you. Thanks for the introduction.
No, don't be silly.
So yeah, I'm Rebecca. I'm a Lebanese Canadian, so I speak English and Arabic to help with some of the patients with translations and things like that. My goal is to get the patients into optimum health with their gums and their teeth during the cleanings. And the most important thing is to tailor each treatment to what the patient needs. So I really walk through the patients with that. I do some treatments, including biological cleanings, deep cleanings, and also we offer whitening too, which I'll explain in a little bit.
Amazing. So this podcast today is just all about oral hygiene. We really wanted to understand the importance of it, what we should and shouldn't be doing, and just have an overall summary of what exactly it is that you do and how important it is.
Yeah.
So firstly, we'll go to the first question, which is, what is the most common mistake that patients make when taking care of their teeth?
Okay, so I think a lot of people know what I'm going to say. Everyone focuses on brushing their teeth, but a lot of us miss flossing. So that's the number one thing I see is patients are not flossing enough. And when you don't floss, you're missing 2 whole surfaces of the tooth. So even if you're being really diligent, you could still be getting gum infection and cavities without doing the proper flossing as well as brushing. So that's the number one thing I see and try and teach patients about. Yeah.
And how many times should you be flossing a day?
For flossing, once a day is enough. If you can reach twice a day, it's good, but we always try and start even just once a day for a goal. And
brushing?
At night, you can do it. Brushing 2 times a day, because you want to brush before you sleep to clean out all the bacteria from the day that you're building up. And then you want to brush when you wake up to clear out the bacteria that you built up during sleeping.
Amazing. So a lot of people think that when you are doing a cleaning that their teeth are going to be pearly white when they come out of the chair. What would you say in regards to that? Because
so they will be a little bit whiter in certain circumstances. So I'll explain it in a way. There's 2 types of staining. So there's an internal staining and an external staining. So the external staining, it will be removed during a cleaning. So this is staining from things like tea, coffee, smoking, things that kind of stick on the surface of the teeth. That, yes, it will be removed. And if you do have the stain, then your teeth will look whiter. If you come in without any stain, then your teeth will kind of be the same color after a cleaning, unless you do something to change the internal color, which is a whitening. So that's the difference of it.
Oh, amazing. Okay.
Whitening, so it will change it will make it brighter, whiter, and change the overall color of your tooth.
Okay, amazing. Amazing.
Yeah.
So they will visibly be slightly whiter. However, in order to achieve that really pearly white smile that people really want to try and get, you would recommend coming in for a cleaning and a whitening as well.
Yeah.
But what about if someone didn't want a cleaning and just went for the whitening? Would you recommend that? Because you've got to remove the stains.
No, I wouldn't recommend doing it unless their cleaning has been within, I would say, about 2 to 3 months.
Okay.
Only because they won't get the same results, because after a certain point, the tartar will cover the tooth. So we cannot get to the tooth surface without cleaning it first, and then we put the gel on the clean tooth surface to get the absorption.
Okay.
Yeah.
And hard or a soft brush?
Only soft and always soft. Always. Never hard. Or even medium is too abrasive.
Oh, really?
Yeah.
Okay.
Yeah. Only soft.
Okay.
And it's the reason is that you don't want to be abrasive on the teeth or the gums. So we already tend to be a little bit rough when we're brushing.
Yeah.
So we want soft bristles to help to clean our teeth, but in a gentle way.
Oh, okay. Yeah. And a really controversial question for you now. Mm-hmm. Electric or not electric? It's not even on the piece of paper that I wanted to ask you. Sorry. Personally,
I use electric. And since I've used electric, I cannot go back, even though I'm an expert in brushing and I know how to do it. I just feel that it's cleaner. I like the feeling. It's like feels like polished. Yeah. So, and it's also proven to be gentler. Okay. Because we don't have to
brush it rigorously.
Scrub. Yeah. So when people are scrubbing like this, that will cause the gums to kind of erode away a little bit. So with an electric toothbrush, you just hold it. It does all the work for you. It gets all the spots. You just focus on where to place it, and it feels really nice. Yeah.
So I need to invest in an electric toothbrush.
They're awesome. Yeah, I love
it. Amazing. My next question to you would be, what is it that you do in a deep scale and polish treatment?
Okay, so
talk us through it.
This is a deep scale and polish. We do scale and polish or deep scale and polish. There's really not a big difference between them. Mm-hmm. It's mostly how much tartar there is and how deep I have to clean. So how I figure out which one a patient needs is I see them first. I assess the gums and the teeth and take a look around, take some measurements of the gums, which is really important, check the swelling, all these little things. And then we do something called scaling, which is done by both an ultrasonic scaler, so it's kind of like an electric version, and then a hand scaler. So the scaling part is going to remove the tartar on the teeth. So this is the hardened plaque and bacteria that grows and sticks to the teeth. Mm-hmm. So you cannot remove that by brushing anymore. So you need to come get it scaled off. And then we do a polish, which removes like the sticky layer, some staining, and this is like that nice gritty stuff that I use with the electric teeth. Yeah, the worry thing. Yeah, then it goes all around. And then flossing, of course. Do your flossing for the day for you, and then and then that's it. So basically, this is like a basic cleaning to remove the tartar, get the gums healthier, and we recommend to do this depending on your mouth. So if you have a healthy mouth, which means you don't have bleeding gums, you don't have any swelling, I would want to see you twice a year. That's the standard minimum. Okay. Just to keep everything in good shape. Mm-hmm. Some people need to come twice or 3 times a year, and then some people need to come 4 times a year. This is just depending on if they have infection or not in the mouth. Yeah. And coming more frequently, it will help them to heal better.
Oh, okay. Yeah. Amazing. Yeah. Amazing. And before they get into your chair, how do you know whether or not it's going to be a deep scale and polish or just a normal scale and polish? So we do the assessments first. So if there's a lot of tartar and staining, then they need a deeper cleaning. If there's some swelling, then they need a deeper cleaning. And just the swelling will make me have to go deeper around the tooth. So that's why it's considered deep. Yeah. And also if it's a lot to clean, then it's considered deep because it usually takes longer as well. So, yeah.
Yeah.
Oh, fab. So you always look at the teeth before.
I
before you
look
do
and
the
explain
treatment.
everything, and then we start the treatment. Yeah.
Amazing.
Yeah.
And going back to what we talked about briefly earlier on when you were listing what it is that you actually do in the clinic.
Yeah.
As a biological clinic here in Dr. Rose BioHealth,
Yeah.
we offer biological cleanings.
Mm-hmm.
So I would like to know what a biological cleaning is and how does it differ from your scale and polish?
So not a lot of people know what a biological cleaning is. So it's really interesting. So the conventional cleaning that I just mentioned, we do that, but we add some steps to it that make it even deeper, even more clean in a non-invasive way, and we use materials that are biocompatible as well. And we use all materials that are fluoride free as well, so it makes it more biological that way.
Okay.
So let's say the conventional cleaning, it's 2 steps. So we do the scale, the polish. The biological cleaning, it's 5 steps. Okay, so we do... First, I would just paint your teeth, and this shows where the plaque is.
Okay.
So it lights up your teeth like purple and pink and everything. And we take some pictures, and then I teach you how to remove the plaque, so you can visibly see it coming off when you are flossing in the chair. So it will come off. Yeah, visually you can see it with the colors, and then. After that, then I do the scaling, like I explained before. If you need to go deep, we do that and everything's done. Then we polish. So then that's your conventional cleaning part is done. The polish is also fluoride free. And then after the polish, we will do something that removes bacteria in also a deeper way.
Okay.
So we use ozone. That it's a machine that will remove the bacteria that you cannot see.
Okay.
So it's like when you're scaling, you're removing the tartar and the plaque.
Yeah.
You can visibly see it. There's also bacteria in the mouth, and as we know, there's bacteria all over the body and in the mouth that we cannot see. So this sanitizes. So it's really good in helping to reduce inflammation, help to reduce cavities, and it can even stop certain cavities that are very small.
Wow, okay. And healing as well, maybe during surgeries.
Exactly.
I know we use it during surgeries as well to promote the healing.
It's really amazing because it's sanitizing. It's taking out the certain bacteria that's causing these problems. There's different strains of bacteria, and we try to take those out. So sometimes the scaling is not enough. So this gives it a deeper way, but it's non-invasive. So it's very minimal treatment, but it has a big impact.
Oh, wow. Okay.
Yeah.
So you will still get the same results as you would a scale and polish and a biological clean.
Biological clean, you'll probably get better results from it because you're also taking out more bacteria.
Okay.
Yeah.
But very, very similar results. But they are just different processes.
Different processes. Yeah.
Longer duration?
Yes. The biological cleaning depends on the month, but maximum it would take about an hour and a half, depending on how much tartar there is.
And then for a normal scale and polish?
Cleaning, the normal one, I would say like half an hour. Then a deep cleaning would be like 45 minutes to an hour.
Oh, okay.
Yeah.
So it's just an alternative and biological clean using the ozone therapy, which is absolutely amazing.
Yeah, and we do more because it's very thorough. We after the ozone, we do dental conditioning. So this is a treatment. It has something called hydroxyapatite in it.
Okay.
It has a super long name, but basically what it does is it strengthens the enamel.
Yeah.
Yeah.
So that's like a biological version of fluoride.
Exactly.
Amazing.
Yeah, exactly.
Oh, fab. Okay.
So, and then another thing I can note about the biological cleaning is when we do the ozone, it's taking out the bacteria. So you're taking out all types of bacteria, the good and the bad. So what you want to do is replenish the good bacteria. So this is a really important thing. We give a 14-day supply of probiotics.
Oh, wow. Amazing.
So this probiotic is different than like you would take as a gut probiotic. This probiotic it's specific to the mouth. So it helps to really give you good strains of bacteria in the mouth and make your mouth healthier overall with the good bacteria.
Didn't actually know that.
Yeah.
So
take it for 14 days.
Oh, wow.
And it tastes really good, actually. It's like a little powder and it's like a blueberry. It smells really good.
What do? Do you just keep it inside your mouth?
Yeah, it's just a powder. You just like sprinkle it in, let it sit there, then it does its magic, and then that's it. And all the patients love the taste. Like they ask me about it. Yeah, it's really good taste. Yeah.
Amazing.
Yeah.
So I definitely need to come in and have a biological clean.
Yeah.
As soon as my braces come off in a couple of weeks' time,
It's really
I will be
amazing.
straight
You'll
in your
love it.
chair.
You'll love
I've
it.
not actually had one before. I've just had a scale and polish. So
Yeah.
I'm super excited to come and visit you. Thank you so much.
Thank you.
Your first podcast was amazing, and we look forward to welcoming you back for many, many more.
Thank you, Shoni.
So thank you.
Have fun.